on this episode of A Tale of Two Hygienists.
There's a divide between everybody, right? There's the dentist, there's the hygienist, there's the admin, there's the assistants, and nobody's working together. So why is that? And I think it would be amazing if the dentist took on that role of leadership to include everybody.
There's things that dentists aren't really taught that hygienists are taught, yet dentists assume they already know more when they literally have not had that education.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists podcast, episode number 466. I'm your host, Andrew Johnston, and thank you so much for being with us today. We have a really good episode for you. I'll tell you about that in just a few minutes, but I am coming off an absolute high of a weekend. I was at the dental hygiene seminars. I was there on behalf of Credits, which is the Central Regional Dental Testing Service, or your clinical boards. But I saw my friends Caitlin and Jason, who have recently taken over the operations there at dental hygiene seminars. They're doing a phenomenal job. It's always fun catching up with them. It's funny because I'm sure Jason's going to love the fact that he got second billing to Caitlin. But Caitlin is a hygienist, and Caitlin, correct me if I'm wrong, audience, but we love Dental Hygiene Nation gear and swag. So, of course, she's going to get first billing over Jason. So, yeah, take that, Jason, if you're ever listening to this. I also saw Deb Carrier from Twice as Nice Uniforms. If that's not familiar, maybe you heard her on the CPR podcast that we did. I think it was January of either last year or the year before. Or actually, honestly, for any number of reasons. She has so many things going on, and she's awesome. Emily Bogue is there, who you all probably know. Laura Winfield from Under One Roof fame was there. Sheila, Wendy, Kim, like the list goes on and on. There are so many people there. And it's interesting because you don't really think that a dental hygiene prep course for the students is a place that you'd see all of your friends, but it absolutely was. And interestingly, while it's great to see all of these old friends, people we've known for a while, I think my favorite part was meeting new people. And normally you'd be like, Andrew, like, you're a bit of a curmudgeon. I know that you don't like meeting new people. And I'd be like, yeah, you're right. Unless they can carry the conversation. And guess what? Everyone I met probably could. And that was great. And there's one in particular. His name is David Torres. He's a dental hygienist. He absolutely can. And he was amazing. And the thing is, like, I feel like I've been doing this kind of a long time, this podcasting thing, right? And I think over the years I've become, like, if you listen to the first episodes until now, you would say that I am a bit more, I actually don't know if I actually know the word, but maybe guarded is the right word. I think it's kind of hard to impress me, I guess, is kind of what I'm saying, because I've met so many amazing people and I've had like a front row audience seat to them, and I can ask them anything I want. I've just been impressed and just hanging on their every word, that when I meet new people, I'm like, dang, that bar, unfortunately for you all, it's set really dang high. We have some amazing minds in this industry. And, you know, I've been fortunate enough to go, interview them on the show. And so when I meet David, first thing, he's passionate. You can just tell immediately he loves what he does. He's also incredibly smart. He loves this profession. One of the roles that he's doing currently is he's helping out students by giving them, really good advice, encouraging them, kind of no matter where they're at in their journey, whether they're about ready to take their, regional boards or, maybe they're taking their national boards or something. He goes and tells them career advice, anything that he needs to help them with. He just loves doing that and just giving them, points to ponder. But one of the things that amazes me, though, is that he gets that bigger purpose of dentistry that I think that sometimes can be lost along the way. I'll say, and he's not going to love that I say this, but he is incredibly successful. But you kind of wouldn't know that. Like, I really had to dig hard to get at kind of like what he has done in this career. He's incredibly humble. He's very well grounded. And, I don't know. I feel like I'm at this point where I'm like, just everyone listening to this episode, make a mental note for the time that you heard his name first, that it was on this podcast, because he's going to go on to do some really amazing things. And I just sit there and just watch David Torres. That's the guy. But I was also, so our table is sitting next to the RDH magazine or RDH Under One Roof or whatever you know them as, their table, and Laura Winfield. And her and I were looking through the magazine covers, like the cover art. And there's lots of really great people that you would know, especially from social media. If you're on social media, then you probably know them. Amazing people in our industry have graced their covers. But it got me thinking, though, after I got to know David quite a bit more, I'm like, why are we not seeing the Davids on the cover? And, I understand that he's not an influencer and he's not super popular and all these different things, but the man is very well accomplished and has done a lot for our hygiene profession. But beyond that, going to the patient care, the communities that he's been involved with to serve are, it's incredible. There are thousands of hygienists that are like David. They're doing just amazing things. I was talking to Lisa, and we talked about this other hygienist who she was telling me about, created a dentistry program at a university. And she's helping to make sure that there is care that is delivered in the more rural areas or maybe harder to access areas, places that they normally wouldn't have any care. We all know people like this. And in my opinion, they deserve to be recognized just as much as any influencer does. And I'm not saying that influencers don't deserve to be recognized, because believe me, they do. But I also say they're very well compensated for being recognized and being famous. So I want to put out a challenge to all of you listening to this podcast, because I want you to think just for a quick minute, who in your circle of friends really deserves a little bit of recognition? Or if they don't deserve recognition, because sometimes they don't want the recognition, right? But if they are someone that can inspire other people to do the same, to do what they're doing, I think that they need to be recognized. And so what I would like you to do, I have a link in the show notes for these types of people. There's an award that is given. It's called the Sunstar Award of Distinction. It's been going on for many, many, many years, and it's given out at RDH Under One Roof. And if you would please just use that link and send a few people our way that really deserve to be recognized. And again, if not for themselves, if for the people that are coming behind them, I would really appreciate that. I would love to see some new faces in the magazines, the publications, the social medias, and all of that kind of stuff. Okay, so enough of that. In this episode, we're doing an airing of an episode of Dentistry Unmasked. Dentistry Unmasked is with Dr. Pam Maragliano-Muniz, who you've heard on this podcast, Dr. David Rice, who you've also heard on this podcast, and they speak with Danielle Avila and Laura Bettencourt, who have also both been on this podcast before, about that dentist-dental hygiene dynamic. And sometimes it's maybe not all peachy and, feels good in the office. Then sometimes it does too, but that is what they're talking about. This episode aired back in April of this year. It was really, really good. It aired on their feed. And just as a side note, if many of you probably know this, but maybe you don't, Dentistry Unmasked and A Tale of Two Hygienists are kind of under the same umbrella, like the same network you can think of it as. And so we did also a collaborative episode that's going to come out next week on, like the Christmas bonuses, holiday parties, things like that. And so this is kind of a lead in to that. So if you like the episode today or next week's episode, another thing I'd like is to help the Dentistry Unmasked audience grow a little bit is let your doctor know. They cover a whole wide range of topics. It's really kind of interesting no matter where they're at in their career, whatever stage of life they're in, there's probably something they're going to be able to pull out of it. And even you, honestly, I hope I never lose you as a listener, but maybe you're just ready for something new. Maybe give that show an add to your playlist and see what the other side of dentistry is talking about. Okay, that is all. I know this is a really long one. I appreciate you hanging in there. Thank you so much for supporting the show, and we will catch you next week. Enjoy the episode with Pam, David, Danielle, and Laura.
A tale of two hygienists.
Hello, friends. My name is David Rice. Welcome back to Dentistry Unmasked. Here, as always, with...
Hey, Pam Maragliano-Muniz. What is up this week?
All the things are up, but especially I think what's up is dentists don't like hygienists and hygienists don't like dentists. Can we just talk about all those things?
Way to just throw that out there. But yeah,
Let's have
no,
at it.
it's a thing. And I think that's really sucky because I feel like I've spent
Me
so
too.
much time in my career trying to talk about the value of the dental hygienist when the reality is they don't freaking like you anyway. So we had to bring on some dental hygienists. So we're going to, two dentists here talking to two hygienists. We're going to go head to head and have this conversation. So we have you guys, I mean, you're known by so many different names, the Diamond Dental Girls, but technically that's not their name. They are El Diamante, right? Hygiene coaches. We've got Danielle Avila and Laura Bettencourt. Welcome, ladies. We're happy to have you here.
Oh, happy to be here.
So happy to be here. Thank you.
So let's jump right to it. So I know that there's this divide. Everybody knows that there's this divide. I was taught that there was this divide in dental hygiene school like 25-ish. I don't know, might even be 26 years ago now. It's scary. And, it's us versus them. And so we know yes, there's the practice owner and the team, and therefore it's us versus them. But what are dentists doing? Give us some specific things that a dentist or you, a listener, could be doing that could be driving your freaking team crazy and maybe making them compelled to consider leaving. Hit us.
I know. Dentists do not give the autonomy or freedom for hygienists to be their own provider.
Tell us more.
So a hygienist will spend an hour with their patients expressing to them that, their oral health is related to their systemic health and they have active disease going on and that they need treatment for whatever it may be. And then the dentist will come in and say, oh, hey, everything looks great. See you in 6 months. Angry.
Totally mind-blowing.
Yeah, that's a thing.
It is.
Yeah, it totally is a thing. When you have that super long conversation, you're super excited about all of the things, even simple as the water pick. And a doctor comes in at the end and is like, yeah, I don't really agree. And it's just like, how could you have that? I just spend so much time with my patient telling and educating them on the water pick, and then you're coming in and you're not backing me up. It's just, yeah, it's frustrating.
David, why are we doing this? Is this because we're afraid to hurt our patients' feelings? Or, I mean, I don't know why, because I obviously have a very specific opinion about this topic, but why do we do this? Why? It sounds like a stupid thing to do.
Yeah, I think most dentists have approval addiction. They just want to be liked. So if they can come in and rescue and save the patient and be the good girl or the good guy in this thing, then yay, look at me. And I get to feel good for 30 seconds instead of doing the right thing and standing by your team. Because I don't know. Do you do that? I know you don't do this, Pam. I know we don't do it in our practice, but what's your take?
I don't know. I feel like the only thing that I do, well, okay, I'm sure that I'm okay.
I mean, I do
I'm not going to say
things.
the only thing because I'm sure there's plenty of things, but I know there's one thing I do that annoys the crap out of my hygienist is I have this small handful of patients that I actually really like talking to, or their friends that have joined the practice and they've joined as patients, and I just can't help myself. And I blab to them for way longer than I should. And there's people that want to pull me by my ponytail and drag me out of the room because I'm going to make my hygienist late. Different situation. But yeah, I feel like we should not do that. Maybe we should just make a call to action. So call to action number 1, let's not do that. Get out of your own way. If the hygienist identifies that this patient has a diseased process going on, which inflammation, even one bleeding point, is a disease process, don't undo it. Okay. Next. What else are we doing that drives you guys nuts?
Danielle.
I mean, I think that you kind of already said that, spending that too much time, we already are crunched for time sometimes, and then the doctor will come in. And yes, sometimes they will agree, but then they're going on their own tangent for the next, 5 to 10 minutes where we're already kind of running behind. So, what else does the doctor do?
Reel them in a little bit.
Yeah, totally reel them in a little bit. I think that David kind of said it too. Just maybe, I don't know if they have to always be right. I think and kind of I don't know how to say it in the terms that, the hygienist only knows so much and I'm the doctor, so I know better than the hygienist. I've dealt with that.
Ooh.
I think that's true for many dentists, unfortunately. I think dentists are largely, sorry, dentists, insecure humans,
Hmm.
right? I
So
mean,
I
we
feel
went,
like I got to
no,
see both sides of this. And like,
yeah. Do you fight with yourself? Are you like hygiene
no,
Pam and prosthodontist Pam?
no, I don't. I feel like I went to dental school feeling like I was a hygienist. I went into dental school as a hygienist. And I don't know what I thought was going to happen. There's two like distinct things that really stood out for me. Number one, like there was never a mention of the dental team. And I remember going after one of the lectures talking to one of my teachers, and I was like, when are you going to talk about how to
Hmm.
utilize the team and like what the team knows, like the things that you can expect of them, you know, in a practice? And they were like, what? And I was like, no, like I was a hygienist. And I feel like there's things that you guys are talking about that I know like way more than we're talking about right now. Why don't we, like, you guys should talk about what the hygienist knows so like you don't have to recreate the wheel. And they were like, that's not an accreditation. You need to just walk away. And I was like, oh, okay, okay. And then the other thing that I like thought was crazy was we spent like a stupid amount of time learning how to explore and then scale a sextant. And you're sort of taught in dental school, like the 11-12 is for mesial surfaces. Have at it. And there was no like real education about like root morphology and like, I mean, enough to pass the boards, but like talking about instrumentation and like doing these things, like that was for, I guess, perio residency. But like there's things that dentists aren't really taught that hygienists are taught. Yet dentists assume they already know more when they literally have not had that education.
Hmm. Interesting. I find too that for whatever reason in certain offices there's a divide between everybody, right? There's the dentist, there's the hygienist, there's the admin, there's the assistants, and nobody's working together. So why is that? And I think it would be amazing if the dentist took on that role of leadership to include everybody, to create that culture. Like Dr. Pam, I mean, you do that beautifully. You're such an incredible leader where you just cultivate excellence within everybody and you want the team to be together. I think that is one thing that butts heads between hygienist and dentist. And if there was more leadership within practices, that could eliminate that.
So Pam, simple call to action. I like where we started with all of this. Simple tip or trick that you've brought to the table that helps your team know that you're all on the same side.
Mm-hmm.
You have to start with yourself. I feel like we go into our practices and we have this expectation that we don't actually share with everybody. And you like point fingers at everybody else, but like, what do they say? Like you point one finger, I don't know, like at least three are pointing back at you. I don't know what you're doing with your thumb, but anyway, I know now everyone's like, what? Anyway, no, but so like, I realized that part of that was my fault. And it was because I didn't talk about what my expectations were and I didn't share what my practice was about. I just sort of like had what I wanted and I started taking the CE to get me where I wanted to be, which I'll never be where I want to be and whatever. But like I never shared that with anybody. So I always say like if you have this divide and your like your office is run by the one stubborn bull in the office and whatever, you need to start with yourself and start with, and it's vulnerable and it's like crazy. Like for me, it was like very vulnerable, creating a mission and a vision for your practice and deciding what your practice is about. And once you know what your practice is about, you have to literally live by those words. And that includes creating this team around you that live by these words. And that might mean some casualties along the way. You might not keep every team member if they're not going to support the mission and the vision of the practice, but it's up to you as a leader to create it and then ultimately share it.
Agreed.
Agreed. Go ahead.
That just makes me think about how hygienists sometimes feel the lack or they don't feel valued, and doing that right there by like looking inwards at yourself and speaking what you want from your own practice would then in turn help the hygienist feel valued. I don't know, at least that did for me.
No,
Absolutely.
I agree. You're surrounding yourself with your people, so it's like, there's people, and then all of a sudden you appreciate them because they're doing the things that you want to see have like, to happen in your practice. So I feel like it's sort of an innate way that one hand washes the other. It's not about you need to be faster, you need to suck it up and use your dull instruments. It's not it's you create what your non-negotiables are for your practice, and everything sort of falls into place. So I think that that would certainly help make the world a better place. So, okay, I'm ready. Hit me with more. What other things are you guys seeing? Because you guys you coach teams, you coach dentists, you coach hygienists, and you hear like all the things that they say. So, and you both have, I know, lived in that story where you both have had to leave your respective practices because your values didn't jive with that of the owner. So go ahead, tell us
Yeah.
more about what you're seeing out there that we should probably rethink as a practice owner.
Yeah. So that kind of, yeah, I can relate right there to that. As far as growing as a hygienist, we see a lot of hygienists that do want to grow within their clinical career, implementing new innovations and technologies, and the doctor just shoots them down. So there's been many times that I've, gone to the doctor and said, "Hey, I'd love to implement lasers. I'd love to implement salivary diagnostics." And they're like, "Nope, absolutely not. That's a liability." Or they come up with some excuse that seems so ridiculous, and it just frustrates you as a hygienist because you want to help your patients get healthy, but the doctor just doesn't support that.
So
So when you ladies are working with a team, how do you position a hygienist in their approach to the dentist that helps set them up for success as opposed to getting that immediate shutdown?
Yeah, I love that question. I think it's a matter of having a productive conversation, right? Everything always starts with conversation and making sure, okay, well, are you both in alignment? What does the dentist want for their practice? Have the dentist look inward. What are their goals? And then have the hygienist have that same conversation, have them look inward. What are your goals as a hygienist? What type of care do you want to provide? Making sure that everybody's in alignment. And then, okay, now once everybody is in alignment, because sometimes, let's be honest, people have to hash things out, right? You have to make sure that you're on the same page. And Dr. Pam, I can tell you want to say something.
I do. Well, how do you do that? So, I mean, we all work in private practice. And so I know what happens. And this is, I mean, let's talk about, I just bought an assistant's chair. This stupid chair has been on a post-it for, I don't know, months. Like I took photos at a trade show, like, I don't know, 6 months or a year ago. I like sent it to everybody. We decided what chair we're going to get. Then it's like, all right, well, let's order the chair. Chair doesn't come. Hey, the chair get ordered? I don't know. All right. So let me write a post-it for the chair. And this whole thing is because we try to do so much on the fly that sometimes nothing gets done. You're talking about this conversation. This is not something that really can happen, right? Between patients or at a huddle. Like, how do you tell people like to have this conversation? Like, how do you make that happen?
Yeah. So we just tell the hygienist to send an email. For us, that's been the easiest way for them to really get the attention of the doctor, and set up a time outside of work, like whether that be a phone conversation or an in-person conversation at the end of the day when there's no patients there, there's no distractions. It's really being clear and concise about, what your wants and needs are, and setting the time aside to have those conversations.
Is the email the strategy regardless of the size of the practice? If it's like myself and five other people, is it still an email, or is that more on a bigger practice or multiple locations?
I think it depends. Obviously, when it's a bigger practice, multiple locations, an email might be an easier way. If it's a smaller practice, you can, in person say, hey, I would like to set up a specific time do you have availability next week at X, Y, and Z so we can talk about this?
And we've heard this ad nauseum that dentists don't get an adequate education in business. Hygienists probably get even less. No offense, but it's just, I think, a fact.
Oh, absolutely.
I've heard hygienists, and I've been on panel discussions and different things where people have encouraged hygienists to come up with a business plan for a purchase. Like, oh, you spend X dollars on this, it's going to equal this, this, and this. How do you talk to hygienists about making that presentation? You know what I mean? Because I don't know if the hygienists, and they probably should, because it's helpful. And I think doctors can understand that better. But how do hygienists learn to forecast what, say, for example, like you mentioned, Danielle, a laser or something like that could bring to the practice?
Yeah. So I think that it's important to, when you are going to approach the dentist, that you do have a plan. So whether that be a business plan or an action plan or something, but how are you going to elevate your standards and the care that you're providing to your patients to make sure that, whether that be a laser, say you want to implement the laser, you know, what's the ROI on that? What does that look like for the doctor? Because a lot of the time it is about the numbers. So when you do have some kind of, you know, back end report or information from maybe another office that you've had a friend work at, or you go and do a little bit of your own research, that you can have some numbers for the doctor. Go ahead, Laura. I know you want to talk.
No, I was just going to say right there, do your research.
Yeah, do your research so that you have an action plan. You know what I mean? So you're just not going to them with, I want this. Well, I want this to help my patients get healthy. This is what I've seen. I've done my research. These are the numbers. Will this be something feasible that we could work together to implement over the next 3 to 6 months?
I like it. That would help me.
Yeah.
Yeah.
I would think so too. And I think that would bring me some comfort saying, okay, they've done all this research. They're super into it. I don't have to do all this research because let's face it, I'm going to call my friends and be like, hey, what laser should I get? You know, so I feel like sometimes that's the extent of research that some of us do as dentists. And I feel like that's kind of already set up for us, which I think is really interesting. So, all right, I like that. So this is an action for a hygienist then. So if there's something you would like to implement it, don't bring it up, you know, in between patients or when you catch the doctor walking out of the bathroom. Like, you want to set up time, have that conversation, and come prepared to have that discussion. Don't just say, I want this, you know, because I want it and I think it's cool. You know, I think that having a real fruitful conversation about it would be useful. All right, I like that.
Can I add one for a dentist?
Yeah.
Okay, dentist. So when your hygienist or assistant, whomever on the team comes to you with this great idea, and maybe they didn't listen to this episode, so they haven't built that business plan, rather than just shoot them down blindly, what if you suggested somebody go do a little bit of research, tell them maybe what you need to help get you over the hump, and then when your hygienist does the work, yay. And if they don't, then back to you, hygienist. That's on you.
Yeah, I love that plan.
What do you want to call that? Like dual accountability. I like that.
I like dual accountability.
Reciprocal accountability. That's cool. No, I like that. I mean, we see so many hygienists, and now it's interesting because if you are on any sort of social media, you know that there's a quote unquote hygiene shortage, and there's a lot of dentists struggling out there. And there's a lot of hygienists that are unhappy and they're looking for another job. And they're like, well, if I'm going to be unhappy because hygiene sucks, I might as well make the most money that I can. So if the guy down the street's going to pay me $2 more an hour, I'm just going to go there because every office is the same. Now, you and I all know that that's not the case, but let's talk about what hygienists want. You know, like, how do you get your hygienist to stay? And I mean, while you are struggling, and I mean, a lot of us are struggling. I mean, I had a hard time finding an assistant back in the day. And it was like, sometimes you just have those moments where you're like, if you have a pulse, I will take you. But, you know, obviously that's not always the best approach. But how do you find the people that you want to have be part of your practice, and how do you get them to stay?
I think that's a wonderful question. I think that comes back to creating that culture. And there's so much more. I mean, don't want to go down a rabbit hole, because I think in general, hygienists need to look inward at themselves and and not just demand a certain dollar amount. They have to see what type of value that they're providing. Like I said, that could be a conversation for another day. But I think creating that culture and looking at all the other benefits that are provided by working at an office, you know, making sure that sometimes you have that downtime to decompress and talk to your coworkers and create that community and that friendship, and realizing that you're building a rapport with your coworkers and your patients, because I think patients see that through and through. I don't know, Danielle, what do you think?
Yeah, no, I think that it is important, like Laura was saying, to create a culture, to create an environment where the hygienist feels valued, to make sure that you have that communication and that connection with the hygienist is really important. And working with them, if there is something that they do want to, you know, learn or implement, how can we work together as a team? How can we, you know, both elevate ourselves and our careers so that we're providing optimal care to our patients? How do we work together as a team and have better communication? I mean, there's just so many different ways in which a hygienist can feel fulfilled and valued and not be looking for that $75 an hour, you know, or whatever that may be, you know, for that hygienist. They can feel fulfilled and valued making that $40 an hour and not go down the street to the other office because they're going to make that extra money, because they feel like they're making a difference and they're making an impact and they have great communication and, yeah, that autonomy to be a great provider.
Yeah, and even to create opportunities within the practice for hygienists. Like, say a hygienist is looking for more of a leadership role. Okay, well, what can you create within your practice for that hygienist to take on a little bit more responsibility, so that they're gaining other soft skills that can help them within their career and have that self-fulfillment.
It also helps the practice too. It's not like it's just about, you know, fluffing up the hygienist. I mean, these are all skills that will make your practice run better, maybe be more profitable, better patient care. It's not like, you know, we're sitting here saying, all right, dentist, bend over backwards and, you know, just make your hygienist happy. It's not really about that. It's really ultimately about the patient. And secondly, you know, the practice, because obviously none of us would have jobs if we didn't have a functional practice. So I think that this is really interesting. So for those that are searching for hygienists, would you say that there's maybe some verbiage that you might put in an ad that might pique the interest of a hygienist?
Oh, I always like, I mean, and this is hard, patient-centered care is like a word or a phrase that I love. And that came from a previous office that I worked for. And I did believe that, you know, when I was working there, that we did provide, you know, patient-centered care, and the hygienist there never left. I was like the first one to, I think, ever leave that practice, ever still. So they do have a decent culture, and you know, but patient-centered care, I don't know, Laura, if there's any other key.
Yeah, patient-centered care, like providing that optimal care, maybe even like saying that you offered the latest innovations and technologies. I think that's huge, because a lot of hygienists do want that growth and want to learn and want to know that they have the necessary skills and tools to provide that care for their patients.
There's a lot to it. I think we could probably do this for 10 hours, but Pam, somehow we cranked through 30 minutes again. I don't know where it went. This has been amazing. Thank you, ladies.
Thank you.
Thank you.
Yeah, I appreciate the insights. I think a lot of us are kind of treading water here, trying to find a great hygienist, trying to find a great addition to their team, trying to find their forever team. You know, I hear these stories of dental practices that have had these legacy team members forever, and that just doesn't feel like it's the case anymore. So we, as dentists, need to step it up and create an environment that makes people want to be there. And also, we want to be there too. It's not just about giving to everybody else, right, David? Everybody's smiling but me. No, we don't want that. We want everybody smiling. So Laura, Danielle, thank you guys so much for your time today and for sharing some insights from the other side that I think dentists will certainly find valuable. So thank you so much.
Thank you.
It's been a pleasure.
Pleasure is ours. All right, David, I will see you next week. And everybody, for Dentistry Unmasked, we look forward to seeing you next week as well. Have a wonderful week. We'll see you then.
Cheers.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.